So ladies and gentlemen, let's get ready for a very interactive session between Dr. Peter and Ms. Arzoo Bhatia. And they will be talking around nutritional psychiatry and mental well-being. So let's have a round of applause for Dr. Peter and Ms. Arzoo.
So we thought, I'm sure that you've seen enough presentations. As much as they're nice and helpful, they can be a little overwhelming, I think. So before we start our interactive session, if it's okay with you, Peter, I'll just take a few minutes to shake up the room a little bit.
Yeah,
so
shake
they
it
can
up.
absorb the energy a little bit more. So what I can ask all of you to do, please, is just stand up where you're sitting. Amazing. All right. So now what we're going to do together is shake a little bit. So let's start with our hands. Let's go. Let's go. Okay. Let's keep doing it. Let's keep doing it. Let's keep doing it. Let's keep doing it. I need to see a little bit more energy, guys. Let's go. Yeah. Let's add our legs to it. Let's shake our legs with our hands as well. Let's go. Let's kick like we're really releasing all this stagnant energy. Yeah. Amazing. Amazing. I need to see a little bit more power and movement. Let's shake. Maybe we can add our hips to this shake as well. Let's go. Can you do it all together? Let's go. A little bit more power. One last time for 5 seconds. Give me all your energy, guys. Let's go, let's go, let's go. Beautiful. Thank you so much. So this is Dr. Peter. My name is Arzoo. I work as a psychotherapist. The shaking is part of our psychosomatic healing movement, and I'm sure you've witnessed this before as well. It's one of the easiest ways to just move your energy, feel a little bit calmer, control your anxiety, and feel a little bit happier as well. So now I'll pass it off to Peter, and then I'll ask you some questions. You want to give your introduction, maybe?
Sure.
Okay.
Well, so I'm a naturopathic doctor. I don't know, who saw me at the talk yesterday? So a couple of you. Okay, and this is the slide presentation from yesterday, which will also be sent to everybody. So if you didn't see my talk yesterday, you could definitely check it out when it's sent to everyone. But I'm Peter Bongiorno, so I'm a naturopathic doctor, and I'm also an acupuncturist. And I've been in practice for about 21 years in the New York area. And I've probably seen thousands and thousands of patients over the years. My interest in naturopathic medicine actually started when I was doing research at the National Institutes of Health. I thought I was going to go to medical school, and while I was there, I had a friend who was diagnosed with multiple sclerosis. And through that process, I found out about naturopathic medicine because she was very poor shape. She wasn't walking well. They told her she's going to need a wheelchair. We were both 23 at the time, and she went to go see this person that was called a naturopathic doctor, and I'd never heard of that, and I thought it was some sort of quackery, you know. I didn't know what it was, and this person talked to her about food, and talked to her about the stress in her life and what was going on with her family and all these things. And I thought, wow, you know, the neurologist we went to go see didn't talk about that. And so she did all the changes, recommended change the food, worked on stress, got more sleep, and started getting better. And I was just amazed because I thought it was a miracle. But I actually, the fellow who she went to see said, oh, you know, you work at the NIH, at the National Institutes of Health. You know, why don't you look some of these things up? You'll find research articles about it. And I remember I found this 40-year, it was this guy named Swank did a study from I think the early 1960s or something. It was a 40-year study. I forget the years exactly. And he looked at multiple sclerosis patients, and he gave half of them normal care, and half of them got a very low saturated fat diet, high polyunsaturated fat diet, and then I think gave them a vitamin. And he found that the exacerbation rates in those patients were so low and that they didn't go on to have any of the problems of multiple sclerosis. And that was my aha moment, because I was reading it in the literature in a scientific neurology journal and thinking, wow, why aren't doctors talking about this? Is actually in the literature. And ever since I've gone to naturopathic school, I've been saying that for years. You know, all of these things that we're talking about at this conference, that all these amazing practitioners, it's in the literature now. And yet, conventional care still isn't talking about it. So it's amazing that we're here, and especially doing it in India for the first time. So, and I know the work you're doing is changing lives as well. I know you have so much passion in your work, so I'm happy to have this discussion.
Yeah, absolutely. So, Dr. Peter, you've mentioned food. Now, Indians are notorious with their diet. We love our food. We can't stop. It's really difficult for us to change our habits when it comes to food. So, what would you recommend could be a little bit of an easier way, I guess, to balance our diet where we might not have to fully, give up our samosas and our jalebis and our chaat?
Yeah.
So what could be a good way to balance our diet?
Yeah, that's a great question. So I think about two things. I think one, I was born in a Sicilian family. My parents are from Sicily. So we eat a lot of bread and a lot of pasta, right? Every meal growing up was a loaf of bread and a bowl of pasta, and then you ate dinner, right? So I had to come from that place and say, well, how do I stop eating all this bread? And what I've learned is not to completely give things up, but to realize, well, what foods are most important and are healthy for us, and what foods are more of treat foods. So now I still love pasta, but I don't eat it every day. You know, I use it as sort of a treat food from time to time. So you have to know your body, right? So some people have very severe diabetes. In the beginning, they might need to be very strict and not have any. But then once they're better and in more balance, and if that's a food that's dear to their heart, then it doesn't mean usually they can't eat it ever. It just means they have to eat it in balance and know their body, maybe check their blood sugar, whatever it takes, and create that relationship with food that works for them. And to realize that when you're minimizing food, you're not necessarily saying no to your culture or saying no to who you are. You're actually saying yes to your health. You know, so you can still honor your traditions and keep your health in mind at the same time.
Right, and I kind of love that answer because it's about your mindset shift, right? So you're not focusing on what you're saying no to, but you're focusing on what you're saying yes to.
Yes.
And that's an important part, right? All right.
Yeah, well said. Well said.
Thank
I love
you.
that phrase.
Thank you. So, something that comes to mind based on what Dr. Peter was just sharing is intuitive eating or bio-individuality, because maybe all diets might not work for everybody in the same way. And because we're so unique to our genes and who we are and our performances and our activities every day, it can be, I think, difficult to say everybody should follow one plan or one diet. However, are there certain foods that are absolutely essential or certain nutritions that we should focus on?
Well, everyone is different. I mean, the first nutrient is certainly water. I think I talked about that a bit yesterday. That it's been proven that when people are hydrated, it improves longevity alone. So even before food, I think water is really important, and a lot of us just don't get enough of it. So I know for me it's hard just to keep a ritual of keeping enough water in front of me and drinking water. So I'm still working on that. And then once we get to food, you know, it's so different for everyone, right? I would say the first thing is to remember that that protein is really important, right? We need to make sure we're getting enough protein in our diet, and that and depending on how your blood sugar is regulated. I know we talk about intermittent fasting, and we talk about some people need to graze all day. I think for most cases, and what we heard in these in this conference is that intermittent fasting is really important and not eating. And I think for most people that's absolutely true. Although having worked in mental health in New York City for 20 years, I find when people have a lot of anxiety, sometimes it's better to make sure blood sugar stays stable. Because when people's blood sugar really drops, their serotonin drops out too, and then their mood will get worse. So there are occasions where I will tell people they need to graze and actually eat. So I don't even know if I answered the question anymore, but if I had to pick one diet, and I said this yesterday, I would probably pick the Mediterranean diet. If I don't know a person, what their allergies or sensitivities are, that seems to have the most data regarding mental health benefits, regarding longevity, regarding lowering inflammation. So probably some version of that would be ideal.
Right, amazing. I definitely can see the benefits of drinking water. I think we could all do with a lot more water. Something to add to the water conversation is also, I think there's so much research now in terms of water has a component where if you talk to your water, it can really change its energy and hence change your energy. And that's coming from a mental health perspective in terms of we want to add good energy to our system, right? So whether it comes to, I think, nutrition or eating or drinking, if we're talking to our food, you know, in our old Vedic times, this was an Indian tradition, and even now sometimes, that if you do a mantra or if you say something and are showing gratitude to your food before eating it, it changes the quality of your food and it changes how your gut takes it. And so those could be just some very simple and easy practices, I think, as well, to maybe add to your diet routine or your eating habits. A question that comes to mind is that you were talking about anxiety and how some people need to maybe grace throughout the day. Are there specific foods that are really good for anxiety?
Yeah, well, the first thing that I think about, and now I'm actually running a lot of tests on every patient I see, I look at omega fatty acid levels, and for many, many patients, they're quite low. In the past couple of years, there's been more omega fat, the ability to study that in the blood, and now I'm starting to see a lot of good data, probably in the last year. And most of my patients who I see who have mental health issues, most of us aren't eating enough essential fatty acids. So obviously the best source of that is fish. So if we're not eating fish, it is challenging. There are essential fats in plants. The problem is that the kind of essential fats in plants have to get converted to EPA, which is eicosapentaenoic acid, which is really what our brain and our nervous system needs. And many of us who have mental health issues, our genetics don't allow a great conversion. There's an enzyme called delta desaturase. Actually, I talk about it in my books. Actually, can I share a slide? Can you put up the last slide in here? Or maybe I could do it real fast. It might go, sorry. Actually, on my last slide, I just wanted to show you my books really fast. So this was the presentation from yesterday. So this is the quick version. There's my dog. And so anyway, what I was saying is that, and I was going to talk about omegas here, but you know there were so many things to talk about. I wanted to hit the basics. But if you go to my books, I talk about the different studies that I use with my patients, and I also talk about this conversion of delta-6 desaturase enzyme and how important it is, and how so many people with mental health issues actually don't have this enzyme, or it's not working very well. So in those cases, we have to strategize how can we supplement omegas. So that is one food I think is really important if that delta-6 desaturase is healthy, and you can do genetic tests. The tests are FADS, FADS 1, 2, and 3, are actual genetic tests you can look at from your blood or from a saliva buccal swab to find out, if there's actually a genetic, what they call a polymorphism or change in your gene that might predispose you to lower saturated fats. So that's one. We talked about protein. Protein is so important because protein sources break down into amino acids. And amino acids are what your system uses to make neurotransmitters, to make your brain healthy. And typically, if your neurotransmitters are low, like if dopamine is low, you're going to have more depression. If serotonin is low, you might have more anxiety and or more depression. And also GABA would be low, which is gamma-aminobutyric acid, which is your calming neurotransmitter. So you'll be much more predisposed to anxiety. So that's one of the reasons when people have very low protein, they're going to have more mental health concerns. So I think that's really important. Fiber is very important, making sure we're getting enough vegetable material, because that's going to feed the good bacteria in our gut. And more research is showing how important the fiber is in our gut to not only move out toxins, but to create a healthy bacteria, which is going to eventually help your gut and your brain make more neurotransmitters to keep your mood healthy as well. So there's another connection there, and that's one of the reasons we want to make sure we're also eating enough vegetables and fruit.
Right, thank you. Thank you for that. I'm aware that in Indian diets, especially because a lot of people in India can be vegetarians, they have a hard time maybe eating fish for omega fatty acids or eating maybe protein in a vegetarian diet. So for that, would you say that supplements do the same job then?
Well, I mean, supplements can definitely help. There's no question. The same job, probably not. I mean, there is so much we don't know, first of all, about the wisdom of nature. All the phytochemicals and all the nutrients and things that are in nature, we're just learning more and more about some of them. And then we don't understand the wisdom of the body. And so understanding how they interact, we really don't understand. So there's so much we have to learn. All we know is whole foods have a lot of beautiful things that come from nature that talk to our bodies in a certain... I remember when I was in school years ago, the first time I got a sense of this concept, I had a teacher, his name was Bill Mitchell, who was a well-known naturopath at the time, and he taught us that, you know, when you eat a carrot, you're not just eating food or sugar or protein or fiber, you're eating information. And that information talks to our cells and helps us decide what DNA gets exposed and what gets made and doesn't get made, and it's very, very complex. So all I know is that when we can, we have to try to get food in as much as possible that's healthy for us, because that's always going to do a better job. Having said that, sometimes people have very challenged digestive tracts. And because of that, they're not going to be absorbing foods very, very well. Like there was a good discussion about proton pump inhibitors yesterday, right? Which was really enlightening. And one thing we know is when we're not digesting our food because we're blocking our stomach acid, it's much harder to break down the food and get the nutrients. Sometimes a supplement might actually make some of those vitamins and nutrients more bioavailable. So there definitely is a place for supplementation. And what I find is when you do a very good protocol that includes sleep, exercise, eating the right foods, relaxation work. We did yoga this morning. I think some of you were there. Pretty amazing. And get the right supplements in. That really is when the body has the best chance of healing.
Right, and I couldn't agree more to what Dr. Peter just said, right? Even in psychology, as a psychotherapist, we talk about the basics. If you have your hygiene, your eating, your sleep, and your exercise together, and you can find time to do all of those things each day in balance, that could really help your mental health. When it comes to supplements, I know we were just seeing a presentation on CBD and nothing against that, but it does make me curious in terms of how many supplements are okay to take, and do they interact or inhibit each other, and are there certain supplements that we shouldn't take with the other ones?
So supplement nutrient interactions is a really fascinating field. And I think we're learning more and more about it. And it's interesting because I know we're in the United States, there's so little study going on because you can't really patent them. It's hard to really make a ton of money on them, right? So no one's studying them at a high level. So most of the studies are coming from places like here, like India, where people are interested in it and they're putting money into it because they want to learn more. And so I think that field is still coming out. As far as how many supplements to take, I mean, I have patients, I try to not have them take more than they need, but oftentimes when people need support in different areas, there might be a few that they have to take at the same time. So when you understand the mechanisms and how they work, they're usually quite safe. If I had to make some general rules about it, I would say the first thing is if you're taking medications, then you certainly want to check with your doctor about what you're taking with your medications to make sure there aren't any overt interactions. The second thing is if you're taking things that are truly, quote, detoxifying, and they're known to change how the liver processes drugs, then you certainly want to be careful with those if you're taking them with drugs. As far as supplements themselves go, and let's say you're not taking any medications, probably the most concerning would be vitamin A, D, E, and K. Those are the fat-soluble vitamins. And you want to make sure you don't overdose those because those can build up and get very toxic in the body. The next one that I think about is vitamin B6. When levels are very high, you can get some neurological issues with that. So I think those are the ones that I'm probably the most concerned with. Most vitamins don't really build up at very high levels. And usually, and the wisdom of the body, again, is usually when you take a natural substance and you start taking too much of it, your digestive tract will let you know way before it hurts the rest of your body. And that's the beauty of herbs, right? When you take herbs, they have many components in them, and some of the components will start to tell your body, hey, this isn't good, and you'll feel nauseous, you feel a little upset, maybe you get diarrhea, because that's the digestive tract telling you, hey, this is already too much. So in most cases, it's hard to get into trouble with supplements. But, if you're taking a medication, certainly be careful. And then, and I think there's a common sense to it too. If it feels like it's too much and your body's saying it's too much, it's probably too much.
Right, and just to kind of piggyback off of that, there are a lot of supplements available, especially I think in the Ayurvedic field in India. And it's important, just as Dr. Peter said, to be intentional and intuitive about what we're putting in the body. Right, so how can we hold space for really connecting, tuning in, listening to what our body says? Because our body is talking to us all the time. It'll tell you when it's uncomfortable, it'll tell you when it's out of its window of tolerance, and it'll tell you and show you signs much before, we're at a place where we're now having a full-blown panic attack or something completely different physically. Something that comes to mind is, I know we were chatting about, the supplements that are for mental health, for example, stress and anxiety. And I think it's important to I don't know, Dr. Peter, what you'll have to say about this, but I'd love to hear. But I think it's important to balance that out a little bit in terms of how much are we suppressing and how much are we holding space for. Because it's not, at least in my experience working with a lot of clients, they'll pop something, they'll take some CBD, it helps with the anxiety, but it doesn't heal it. So it always somewhere ends up coming back. So I think one important aspect could also be holding space, which basically means that when you're feeling anxious or when you're feeling not okay, maybe sad or maybe depressed, can we stay with that for a little bit? Can we build tolerance to that for a little bit and really help it process instead of suppress? What do you think, Dr. Peter?
I love exactly what you're saying, and it makes me think that I'm getting more and more interested in this idea. Diabetes, right? Years ago, when there was no food and we had to walk and move all the time to get our food or chase it down or whatever we did, if you could take in a calorie and pack a little bit of fat, you made it through the winter, right? So the genes for diabetes are actually the genes of survival a long time ago. The problem is now we have a lot of food and we don't move much. So now those same genes of survival and of power are actually a problem for us. Depression and anxiety, those are symptoms, right? And our body's trying to tell us something. Anxiety is there to protect you. You get scared and anxious so you can fight or you can run. Depression is when you feel so overwhelmed that you just want to crawl under a rock so you can go think and you can process. But sometimes today's world doesn't allow us to do that. So exactly what you're saying, becoming mindful about that and realizing, now here's the thing, with anxiety, it could become so overboard that then you can't function, and depression can become so overboard that maybe you don't want to be here anymore and take your own life. So that's a different situation that requires a little more monitoring. But most cases that people are getting prescribed medications just constantly for are really situations where our body's just talking to us and saying, okay, there's things out of balance, what are they? And we talked about them yesterday, and that's what I talk about in my books. What's out of balance? What is our body trying to teach us? And can we take the time and do that? And so, yeah, I love that idea of saying, okay, this isn't comfortable. I hate this right now. I hate how I'm feeling. But what is my body trying to teach me? And how can I move through this or get the supports I need to help me sit with this and figure out what the next step is?
Absolutely. And I think sometimes cocooning, retreating can be taken as a bad thing. People like your family members are like, are you okay? Like, are you, you're not hanging out with your friends anymore. You're not going to work today. But maybe that's also tuning into your body because, there's seasons.
I was going to say, I talk about in this book, as one of the first books I wrote, in Native American culture, when people are depressed, they would put them in a teepee and burn a lot of sage and leave them there for quite a while. And according to anecdotal evidence and storytelling over the years, that was a very effective way to help people with depression and get out of their depression. They cocooned. I love that. That's a great phrase.
Right. And so normalizing that, maybe if your kid is cocooning and taking some time, of course, it's important to know where the line is between maybe the too depressed or struggling versus, hey, my body is telling me I just need to take time. For example, the winter is known for that, right? Nature teaches us this, but we've kind of gone out of whack with it.
Yeah.
Right?
Yeah, the winter is when your serotonin becomes its lowest because the angle of the sun changes and our brain naturally makes lower serotonin. So we can go to our cave and calm down. But what do? Usually like in the winter, I know in the United States, that's when the holidays are, So we're asked to be like this when we really want to just be like this.
Absolutely. And so inviting you all to just really, I think the message I'm getting from Dr. Peter is that, it's important to tune into yourself. It's important to balance things out a little bit more and normalize them. Whether they're taking supplements, whether it's a particular diet, let's be intuitive, let's be intentional, let's be connected about it. Is there anything else, last few words that you'd like to share with everybody, Dr. Peter?
Yeah, no, I mean, it's, the last 20 years have been remarkable, and I've been so lucky to have so many people. It's been such an honor to have people share their experience with me and their mental health concerns. And all I could say is I've seen, very remarkable results of people who were told, well, this is how it is for you, and you just have to take these drugs, and really see remarkable change. And not because of anything I've done, but because the body really knows how to heal when it gets what it needs. So if I could express anything, I'd say, just trust the body, trust the body's healing energy. It knows what to do, and it just needs the supports to do that.
Thank you, Dr. Peter. Thank you.
Oh my gosh, what a pleasure. Thank you, Arzoo.